Good? We good? We good. Oh, alright. What is really good, future, and all my day ones? Welcome back to the channel. Today, man, this video is everything about travel nursing that you need to know. This is probably going to be my last informational video to address absolutely everything that is involved with travel nursing and everything on the table, okay? But before that, I want to tell you guys a story. So approximately a year and a half ago, this was when I was still at cardiac surgery over at Centero Heart Hospital. For the most part, if you know me, I will be going back to that unit only because my practice has done this. I plateaued. At the time, I was taking care of patients who were fresh post-op cabbages, AVRs, MVRs, VADs, BiVADs, Impellas, anything that was cardiac surgery related, name it, I took care of it. At that time, I was confused. I didn't know what I wanted to do in my practice, and it was just at that point where I felt like I had to get up and go do something. I started to ask around, and I knew that there was a traveler on my unit. Her name is Jen. Shout outs to you, Jen. Jen actually hooked me up with her recruiter, and things kind of went from there. The more that I spoke with a recruiter, the more I became intrigued and interested in the idea of travel. And for the most part, travel is definitely something that I don't take granted for or regret doing, only because I've made so much great connections and I've met a lot of great people. I'm not knocking anyone's hustle. Approximately half a year ago, when I started to look into travel nursing, I was trying to exhaust every option as a nurse to see if money was going to make me happy. Yes, money does make me happy. You know, making approximately $2,000 a week as a traveler, one thing I've realized is that I was sacrificing my practice for exactly that, was sacrificing my practice for money. And don't get me wrong, when I first started traveling about a year ago, I was very shocked in the culture of travel nursing, but then I realized that this is what it is that we're there to be relief. It is really up to you whether or not like you love this stuff, if you like to float, if you like absolutely everything about nursing, if you like to take a heavier load sometimes for patients. The most you'll ever get is 4 patients. And need I remind you, I started off in a med-surg, and this was my first practice. And when I first started traveling, I realized that I was going back. I was reverting back to where I began. This was something that I told myself that I didn't want to do, was revert on my practice. And yes, the pay was great, and that was definitely something that I really liked weekly. And granted the opportunity, you know, I was going along with it. And for the past, I'd say for the past 3 months after my last contract, and then I renewed and I left home, I realized that I wasn't happy and that travel nursing wasn't for me. And that's why I decided to leave. That's why I decided to go back to my old unit, which in turn, they were opening a new floor, and which is great because not only did I get a raise, I got also a sign-on bonus. You know, they pay less, but that practice is going to get me to the next level, considering the fact that I did level up with my CCRN, and I want to get my CSC and then hopefully become an NP or CRNA one day. And that's everything from the past year up until now. It's like what's been going on in my head, what to do next. I read a lot. I read a lot of books that inspire me to do better with my practice, especially when it comes to excelling as a person and your personal growth. So right now, there's a couple topics I want to talk about with that, and I'm going to help prepare you for travel nursing. And let's first talk about travel agency. A lot of people are asking me, what travel agency should you go with when you're a beginning traveler? Now, this is something that I honestly didn't know, and I had to ask someone about it. And it's a great thing that I went to USSI, and they kind of gave me numbers and figures, and from what I understand is that there's a handful of travel nurses, and there's a lot of agencies trying to sign these travel nurse professionals. By doing so, they'll basically throw figures at any nurse just to get them to sign with that company, and that's how they basically do it. And your first travel nursing job will basically determine whether or not you will continue to do so. Some people have a good time, some people have a bad time. The agencies that you pick, it will also depend on your recruiter whether or not you stay, how well you are treated with your recruiter, and basically overall your experience with this company. So what I'll do for you is I'm going to link you to 2 people that I know personally and I've met. I haven't met MayLane, but she's just been the greatest recruiter ever since. But I also have a link at USSI. They're the lead recruiter and they've been actually voted top 10 travel recruitment agencies, and I'm going to link them down below. And they're gonna ask you who referred you. Tell them Genesis Santos, and they're gonna, what's it called? They're gonna hook you up. And these are people who are going to get you settled right where you need to be, and they'll get you assignments and whatnot. They could even place you as a new grad if you need. They are very great links to work with, and I cannot stress enough finding someone who's going to help you get on the right road. Now, look, some of your friends will tell you sign with my agent, but the agent that you sign with, remember, you want to be taken care of, okay? And I can vouch for these people only because when I needed them the most, especially MayLane, when I needed her, she helped me, especially when it came to like tax things and all that. So next is your taxes. I haven't touched upon this just yet, but a lot of people are wondering about taxes. One thing that I've learned with taxes is to keep all your receipts. Now, anything that you spend outside of your state and it's taxed, you could actually write off as a tax write-off in business purposes for travel in regards to your job. I also didn't tell you this, but you get a travel stipend. If you do travel and spend all the money, then of course you're not going to be writing that off because that would be perjury. But from my understanding is, if for example they give you 500 travel stipends, 250 to go to California and 250 to come back from California. If it does go over the 250 limit, like for example you buy a ticket for $350, that $100 can be written off as a tax write-off. And all your meals, all your food, like everything that you're spending your money on, keep your receipts, okay? That's very important, because like when you go back to where you're from or when you're filing your taxes, make sure that you are doing it with an accountant, because they're gonna need your receipts, okay? Also, from what I understand, this is coming from the grapevines, someone who is a friend of mine who travels as well. He bought for example, he bought a laptop and he needed it for school. He was able to write that off. Just have your contract ready to go, and also apartment, for example, if you are renting out of state, you could write that off as a tax write-off. Or if you did like rent Airbnb, the receipts for that, keep those definitely, okay? Which actually leads me to the next topic, and that is whether or not you should be staying at an Airbnb. Should you take the housing, or should you stay with a relative? Obviously the best option would be staying with a relative or a friend. If you do decide to take the housing, which was my first option, my first started travel nursing was to take the housing, so to familiarize myself with the Los Angeles area, or do an Airbnb, which I did toward my very last assignment, and that's gonna be up to you depending on your budget. Picking your assignments, this is tricky. Depending on your level of experience, if you're med-surg, OB, ICU, it is very important to pick your battles, especially when it comes to your assignments. I personally stuck with 2 hospitals this whole travel experience, and it's just because like I get tired of having to reorient. It gets tiring, and you have to kind of find the median for your practice and something a little bit more stable. And I found that here at Kaiser. I found great people who actually helped me in my practice to advance, and that's what you want, is like something that you could find. If you do like an assignment, stick with it. And if you do want to try other things or other assignments, try it. Like there's always going to be a catch, especially if you hear like sign-on bonuses, or if you hear like, for example, like emergency rates. Emergency rates means it's going to be higher than what they usually offer. Sometimes your base rate would be like, for example, your base rate would be $19 and your stipends be $3,000, which would be like a mixed rate of $60, something like that. And you're basically overall making $60 an hour. You really want to be aware of certain contracts, especially when it comes to tax purposes. So you need to be spending your money on something as well, just so therefore, you know, you're showing the IRS that you were out of town and that, you know, you were here for a job. Another question that I obviously get a lot of is, how is your transportation? I personally did not bring my car to Los Angeles, only because I knew I was going back to the East Coast, and I was not willing to drop $2,000 to transfer my car back and forth. And yeah, some people need to drive, but I got around just fine. I was able to do the things that I wanted while I was out here. But if you're someone who's always out and about, definitely bring your car with you. It'll be worth the investment. I personally didn't bring it because I was able to do everything that I absolutely wanted to. I personally wanted to go to San Diego, but that wasn't the purpose of the whole travel journey for me. My whole travel journey was basically to get out of debt. Now I know that this video can be very long, and there's a lot of topics that I can touch upon. And this is definitely something that I feel like I've become proficient in, and it's only because like I've only been doing it for a year, and I know that there's tons of things I could touch upon. I think the most important thing are the topics that I covered today, and it's very important to keep in mind that anything and everything that you basically touch upon, you will need to take note, meaning to say that you yourself are going to go through the experience. And it's important to learn from the experience itself, because again, travel nursing could be taxing on the body. It could be something that could be great. You could pay off loans. That was my whole goal of this, was to pay off credit card loans, or not credit card loans, loans and credit card. And I did that, and I was able to save a little bit of money on the side. That was the overall goal for me. And do I regret, you know, being a travel nurse? I don't, only because it was something that I wanted to do. It's something that I felt like I need to do before stepping into that next practice, you know? And that's what's gonna make you a great practitioner one day, if that you decide to go that route. It's nonetheless experience. The last piece of advice I'd like to give to each and every aspiring travel nurse is to have fun, because you're only gonna live and be young once. Or if you are an older person and this is what you want to absolutely do, then by all means, you know, take full advantage of it. And because it's a great gig, not for everyone obviously, but definitely something that I feel like as a person someone should go through it, and you'll grow. With that being said, any inquiries at all, leave them in the comment section below. I will try my best to answer your questions in the comment section below, and I wish you luck. And for those who are asking about travel nurse pay, I did a video already on that. I will leave a link somewhere here. I wish you luck in your travel nurse careers, or your nurse career, and those aspiring travel nurses. And you know, you gotta take it step by step, day by day, and things will pay off. And I guarantee you that if it's something that you love, it'll be something that you'll be successful in. I feel like I'm successful in it already, and that I'm ready to go to the next level, and that I kind of shared something with you guys along the way, and that you learned from it. Okay, so hope you guys enjoyed this video. Smash the thumbs up button if you guys did. I will see you guys in the next video I produce. My hair is all over the place. Y'all take care. I love each and every one of you guys. Take care. Bye.